Fine. So yeah, when Marie tips her head forward, I see her one of her cervical spines sticking out. I kind of put my finger at the top of that notch. Then I go to the outside, the most lateral portion of her shoulder, this bony prominence right here. And to find gallbladder 21, I go half the distance between the two. And it's a really nice, tender point. A lot of people remark feeling really good. It can be very tender, but this is a very good point for descending, especially when labor, when you want to get that baby down a little bit lower. So this also feels good for moms in labor. But for inducing labor, it's also very powerful. So I work them both at the same time. If I get tired, I can put my elbow in. You know, I could work with the blade of my hand. But basically you want to find the highest point between these two markers, and that's your spot. Okay, the last point is on the sacrum. Let's see, you just turn around a little bit. So if I look at Marie's back, usually you can feel the sacral bones. A good way to feel the sacrum is to kind of run your two fingers, and you should feel little like kind of holes. Those are the sacral foramen. As you come up, they sort of disappear, and then you get right into the spine. I feel her L4, L5, L3. So when I run my fingers down her back, I'll kind of come off the spine and hit a flat plate, and that's the sacrum. So good points to massage, especially if there's like a history of back pain or kind of clotty menstrual cycle. These are good points really to get labor going. And when labor's going, these are good points to help speed things along. So I can feel these little notches. Do you feel that, Marie? Mm-hmm. Yeah, so you kind of just massage. And if your fingers get tired, you can kind of work your thumbs in. That's a lot more strong, actually. So I'm doing like little clockwork circles, clockwise circles going around the sacrum, and I can move my hands down. Other good points, along the lateral aspect of the sacrum are really tender points, especially if the woman has a lot of back pain. This can be really good for getting the baby down. One last point